Our next speaker is Dr. Eleni Iasonidou. Dr. Iasonidou is a pediatrician and founder of Long COVID Greece. She is one of the very first Greek representatives to join Long COVID Kids. Dr. Iasonidou, the floor is yours.
Good morning, my name is Eleni Iasonidou. I'm a pediatrician and long COVID patient. Before we start, I would like to thank Dr. Kavanagh and Dr. Papas for the invitation to speak at this conference, among other distinct guests, for long COVID and its impact on patient, workers, and society. Today, for the first time, I'm taking advantage of my dual identity as a doctor and patient. My journey began in October 2020 when I first got infected with SARS-CoV-2. Mainstream communication at that time was that older people with previous health condition were at risk. I was not at risk, or so I thought. I was 47, healthy, fit, with normal BMI, and no previous health condition apart from asthma, which hasn't bothered me since I gave birth to my twins 2 years ago. And so it was a mild initial viral infection with obvious asthma exacerbation, plus loss of smell and taste, as expected. The odyssey began 20 days later with negative PCR and pericarditis. Unfortunately, since then, I have never returned to my previous health condition, with symptoms that come and go: reinfections, fatigue, heat, medication, alcohol, but also other viral infections contribute to an ongoing roller coaster of symptoms. In time, some symptoms subsided, like breathlessness and tachycardia, like they are not gone completely but become bothersome under symptom exacerbation. Others remain the same, and some, like cognitive deficits and muscle weakness, are getting worse, or at least I'm getting less tolerant. What was also frustrating was the fact that 8 months past initial infection, I was not even close to recovery. And even though I was a doctor, I had no idea what was wrong with me. I had heart palpitations, but my cardiologist said that I had overcome pericarditis, and I was fine. I was breathless and exhausted, but my pulmonologist had my asthma under control, although it took quite longer than usual. Then, what was the problem? I remember waking up and feeling super and thinking, bah, everything is in my head, and then getting off my bed and all my problems kicking in. I was thinking, pre-COVID, when I had asthma exacerbation, they usually lasted 10 days, and then I was up and running 10 kilometers. What is different now? I was feeling lonely and lost and in search for answers. The first one that gave me a clue of what might be wrong was Dr. Papas by sending me an article connecting cough, dyspnea, and fatigue with the vagus nerve. I remember replying that somehow tachycardia is also involved, and yes, the vagus nerve is responsible for postural orthostatic tachycardia syndrome. My neurologist confirmed that I had dysautonomia. It was not better, but at least my symptoms had a name, and I was not losing my mind. In this slide, it's me pre-COVID chasing a baby crawling all around. I am and I look healthy with plenty of energy. Nowadays, with the 5-year-old self-sufficient children, I'm totally drained and exhausted. The only thing in between is COVID. The next picture is my daughter's drawing, me and her in bed like real life. COVID has stolen from me moments of motherhood, plenty of hugs in bed but unable to lift her off her feet and dazzle her with dances and physical activities. Now, next slide. This is my neuropsychological evaluation a year post-COVID, with severe deficit in sustained concentration and attention, severe decline in speed processing information, and severe decline in response speed. My life post-COVID? A book lover who can't read a book. At some point, I could merely watch TV more than 30 minutes. My Netflix profile has changed. I used to love action movies with fast scenes and adrenaline rush. Now I'm the romantic slow motion type, where even a kid's animation movie like Polar Express can make me seriously ill. I cannot exercise. During the first lockdown, I was doing high-intensity interval training. Now I'm happy to walk up the stairs without getting breathless. I feel like I have aged prematurely, like I'm 20 years older and not just 3. This is not me. My personal experience became the stepping stone to get involved with long COVID advocacy. In March 2021, I founded the Greek support group on Facebook Long COVID Greece. By May 2021, we were already among founding members of Long COVID Europe, and by September 2022, Long COVID Europe becomes official partner of WHO. By September 2021, I get actively involved with the Long COVID Kids charity, and by December 2021, we have the legal formation of our patient association with Long COVID in Greece. We try to make Long COVID visible with TV spots, website, and connecting via medical association and universities. At the same time, we ask for recognition and labor rights, but everything starts with an ICD-10. The addition of U09 for long COVID in Greece took place just this year in March, but still a lot must be done. In our effort to make visible long COVID, we published the Greek Collaborative Long COVID Study, which is the first study in Greece on long COVID to address non-hospitalized patients, comparing their symptoms to those who had been previously hospitalized, showing lingering symptoms for more than 1 year. Up till then, non-hospitalized patients in Greece were denied access to post-COVID clinics. Based on our research, most reported symptoms were fatigue by 70%, neuropsychiatric issues like brain fog, sleep disturbances, and mood disorders by 43%, musculoskeletal issues by 51%, tachycardia 28%, shortness of breath and dermatological issues by 18%, and olfactory disorders by 16%. Despite the variation in the initial severity of the acute infection, patients with initial mild symptoms suffer from the same symptoms as hospitalized. And we can see there is no significant difference between most symptoms in these two groups of patients, with 2 exceptions. First, mood disorders, such as anxiety and depression, were 6.5 times more common in hospitalized patients, reflecting a statistically significant difference. And second, olfactory disorders were 12 times more frequent in the non-hospitalized group. Now let's see some more results. Patients with long COVID were the majority women, were in the age group 41 to 50, but syndrome was also frequent in ages 21 to 40. Most patients were never hospitalized by 70%, and only 1.2 had been to ICU. By 2021, half of the patients had lingering symptoms for 7 to 12 months and 22% for more than a year. Unfortunately, if the research took place now, people with long COVID would report symptoms for 3 years or more. Regarding the impact on long COVID on employment, 60% of patients are faced with work difficulties due to prolonged symptoms. Moreover, only 10% of the responders are attended to by public hospitals and 9% are not. Half of the responders have visited up to 10 different doctors and spent up to €500 in search of answers. Regarding rehabilitation, it is important to know that the seriousness of hospitalization seems to be a defining factor. Namely, all patients admitted to ICU followed a rehabilitation program. On the contrary, most of the non-hospitalized were not offered such a program, and the majority were unaware of such possibility. When asked whether they've encountered doctors with awareness of long COVID, the majority responded having encountered doctors who were unaware of long COVID. Lastly, our paper proposed a diagnostic algorithm for persons with symptoms lasted for more than 3 months after COVID infection. And what about children? Let's see what long COVID kids say and young people with COVID 2021, published in 2022, the clinical characteristics, activity level, and mental health problems in children with long COVID. Sam McFarland, in collaboration with Dr. Buensonso. In this slide, we see on the left the age of respondents at COVID-19 infection. The majority are in the age range of 10 to 15 years. And on the right, the time from infection at date from response to long COVID kids questionnaire. Overall, children had persistent symptoms for a mean of 8 months. Here we identify some of the most frequent problems with kids' diagnosis. Children are not tested and dependent on parental confirmation, presentation, and documentation. Children with unconfirmed but suspected infection, how do they fit in future research? Could they be involved as control groups? And of course, everything depends on who is doing the research and if there is an active patient involvement to acknowledge the pitfalls. Most frequent symptoms reported, and next slide please, are fatigue, headache, muscle and joint pain, stomach pain, post-exertional malaise, rashes, and palpitations. Post-COVID, only 10% had returned to previous level of activity. Regarding neuropsychological presentation, several parents reported lack of concentration, difficulty remembering and processing information, and memory issues. February 2022, we have the first definition of long COVID in kids by the CLOCK study. It is like WHO definition for adults. Long COVID is a condition in which a child or a young person has symptoms after a COVID diagnosis which impact their physical, mental, or social being and interfere with some aspects of daily living. Symptoms must persist for a minimum of 12 weeks after initial COVID diagnosis. February 2023, we have the WHO definition. Post-COVID condition occurs in children with a confirmed or probable diagnosis of SARS-CoV-2. What is the prevalence of long COVID in kids? We see that there is a high variability ranging from 1.6 to 70%. Problems: diagnosis, definition, control bias, selection bias, control group, that guardian must recognize signs and symptoms and refer them. Younger children are less likely to be able to consistently report symptoms of relevance, and this could lead to an underestimation of symptoms prevalence in this age class. Severely affected children or high achievers are easily recognized. Less affected could get lost. False negative control groups. This is a multi-center cohort study by the University of Calgary examining what proportion of children infected with SARS-CoV-2 who were tested in emergency department reported post-COVID condition 90 days after their emergency department visits. Out of almost 2,000 children with COVID, with 90-day follow-up, 5.8% of patients reported post-COVID condition, including 10% of hospitalized children and 5% of discharged children. The numbers from the ONS in UK as of March this year, 2023. According to ONS, 62,000 children are now living with long COVID. 59,000 children have symptoms for more than 12 weeks, and 53,000 children have symptoms for at least 1 year. Now, this is a nationwide Israeli study comparing symptoms among children with and without COVID infection in children aged 5 to 18. We see that most long COVID symptoms were more prevalent in positive children, like headaches, weakness, fatigue, and abdominal pain. Symptoms were more prevalent in the older age group. Symptoms were more prevalent in negative children, like attention problems, stress, and weight changes, could highlight the impact of the pandemic itself rather than infection. Strength of the study: it's a nationwide coverage of participants, a relatively large number of participants with a broad age range, and there is a comparison of children with or without a history of COVID infection. And now we go to the United States and CDC. CDC analyzed linked medical claims and commercial laboratory data for persons with a healthcare encounter possibly related to COVID. Analyses were restricted to children and adolescents aged 0 to 17 years from March 19 to January 2022. Children with laboratory-confirmed COVID infection were matched to those without recognized COVID and followed for 60 to 365 days or until January 2022. Compared with COVID-negative patients, those with previous COVID had higher rates of acute pulmonary embolism, myocarditis, and cardiomyopathy, venous thromboembolic event, acute and unspecified renal failure, and type 1 diabetes, all of which were rare or uncommon in this study population. Patients with COVID-19 were significantly more likely to develop post-COVID symptoms of smell and taste, disturbances, circulatory signs and symptoms, malaise and fatigue, and musculoskeletal pain. On the other hand, those with COVID-19 were less likely to experience respiratory signs and symptoms, symptoms of mental condition, sleeping disorders, anxiety and fear-related disorders, and mood disorders. This study has also its strength and limitation, but at the same time has a major implication for public health practices like COVID-preventing strategies, including vaccination for all eligible persons aged 6 months and above. Puzakina and associates investigated prevalence of post-COVID-19 condition at the 6 and 12 months follow-up amongst previously hospitalized adults and children and assessed risk factors. Although prevalence of post-COVID condition declined 1 year after discharge, 1 in 3 adults and 1 in 10 children experienced ongoing sequelae. In adults, females and persons with pre-existing hypertension, and in children, persons with neurological comorbidities or allergic respiratory diseases are at higher risk of post-COVID condition. In this comparative study from Italy, exposed children had a 78% higher risk of developing new conditions after COVID-19 than unexposed children, including mental health issues and neurological problems. Risk factors for long COVID in children and adolescents are older age, female gender, poor physical and mental health, severe infection, allergies, and atopy. What's the impact on long COVID on the school experience of children and young people? This is research by long COVID kids. 3 key findings were identified. Finding 1, going to school is a valued part of children's lives, and returning to school full-time was highlighted as a key part of regaining normal life. Finding number 2, attending school with long COVID is extremely difficult. Even a gradual return required children to balance the impact of being at school with the need to manage symptoms to prevent relapse. Often, this meant prioritizing school and rest over the other aspects of their lives. Finding number 3, school responses to children with long COVID were reported to be mixed and hampered by difficulties communicating with healthcare professionals during the pandemic and the lack of awareness of long COVID among healthcare and education professionals. Results from this survey show that 75% of respondents were greatly impacted, with only 7% of children being able to attend school for 5 full days. 29% of respondents estimated that their child education has been disrupted, whereas 69% report that their education status has changed, like significant reduction in hours, leaving education entirely, implementation of hybrid or home learning. In terms of change in education status since COVID, only 1.5% are attending school full-time, 6% are now home educated, 9% are receiving hybrid education, and 10% are not attending school because of illness. And now, how about quality of life in children with long COVID? The most frequently reported difficulties were being emotionally affected by health problems, day-to-day school, walking a long distance, standing for long periods and concentrating for 10 minutes. And how do children with long COVID feel? Children felt embarrassed about having long COVID, felt embarrassed about having physical limitation, less valued and different from peers, that people behave differently towards them since they might be lying, less respected, that people thought that long COVID is not a real disease. Other people thought that developing long COVID is a sign of weakness, and that other people might judge negatively due to their diagnosis. Now, what are the future implications of SARS-CoV-2 infection? COVID is associated with an increased risk of neurological and psychiatric sequelae in the weeks and months thereafter. How long these risks remain, and do they affect children and adults similarly? In this analysis of 2 years retrospective cohort studies, they extracted data from electronic health records of 89 million people from 8 countries. They identified a cohort of patients of any age with COVID diagnosed between January 2020 and April 2022 and matched to a cohort of patients with any respiratory infection. At 2-year follow-up, they found the risk of cognitive deficit, dementia, psychotic disorder and epilepsy or seizure remain elevated 2 years after COVID infection, while the risk of mood disorders and anxiety subsided after 1 to 2 months and saw no overall excess over the whole 2-year follow-up. For children, they found that risk trajectories different. They are not at an increased risk of mood or anxiety disorders, but at risk of more severe complications like epilepsy and seizures, stroke, and intracranial hemorrhage. And what about health outcomes? Could there be a link with previous COVID infection? This is a nationwide cohort study where they looked at the electronic healthcare records of an Israeli nationwide healthcare organization and compared health outcomes by age subgroup for a year after COVID infection and matched them to uninfected people. In the 12 to 18 years group, strep infections were significantly high. In the 5 to 11 years subgroup, streptococcal tonsillitis was significantly higher, whereas risk of conjunctivitis was significantly higher in the early phase. In the youngest age group, 0 to 4 years, they observed elevated risk for conjunctivitis and dyspnea only during the early phase. We see that they measured increased risk for streptococcal tonsillitis up to a year after COVID infection. This may indicate an increased sensitivity for this bacterial infection after COVID-19. The high rates of conjunctivitis post-COVID may be mediated by reduced immunity, leading to increased susceptibility to other viruses such as adenovirus, which in turn trigger conjunctivitis. Further investigation is needed to determine whether these increased risks are limited to strep infections and conjunctivitis or reflect immunological health outcomes inherent to COVID-19 in general. A study published in JAMA Network analyzed electronic healthcare records from 9 U.S. hospitals. They found respiratory infections were also associated with COVID-19. In children with previous COVID infection, there was a 26% increased risk of tonsillitis, bronchitis, and pneumonia in the next month following COVID infection. In another major study from the United States, they found that children with previous COVID infection had an increased risk of RSV bronchiolitis by 40% in infants younger than a year and by 32% in children up to 5 years old. These studies provide evidence that COVID contributed to the 2022 surge of severe pediatric RSV cases. The claim that mitigation strategies led to reduced exposure to pathogens and hence there is an immunity dip is not convincing. In Netherlands, in a big study, they reported that there was no reduced exposure to Streptococcus during the pandemic, but possibly post-pandemic increased activity of other viruses. The same findings were observed in a French study. And it's not just infections on the rise post-COVID, but so is type 1 diabetes in children. The diagnosis of COVID-19 in children was associated with an increased incidence of type 1 diabetes since 2020 in Bavaria. The studies found that COVID infections contributed to the observed increase in type 1 diabetes during the pandemic. Possible mechanisms include the initiation of autoimmunity or acceleration of disease progression. The same conclusion by the systematic review and meta-analysis of 42 studies, including 103,000 youths. The incidence of type 1 diabetes was higher during the COVID pandemic compared with before the pandemic. And how about pediatric hepatitis? Over 1,000 cases of pediatric hepatitis of unknown origin have been reported worldwide. Adenovirus was suspected initially, but it's unclear how viruses contribute to pediatric hepatitis. In the case of SARS-CoV-2, could be the result of autoimmune hepatitis, but this has yet to be established. I would like to close my presentation with a little food for thought. Those are the numbers of long COVID reported by patients during different periods of time, reflecting different health policies and different variants between two support groups, one of the UK's and one from Greece. Observation number 1. Initial lockdowns have protected people and gave time for vaccination. Observation number 2. There is no mild COVID if we look at the numbers of long COVID in Greece. Observation number 3. Reinfections are not innocent. Long COVID has never stopped. We have a new generation of long COVID patients who became ill after second and third infection. I will end with Jay, who is 12, wondering, what's wrong with me? The doctors have not been able to help much because they simply don't understand my condition. We can't dismiss what we simply don't understand, and in fact, we need more research in search for answers and treatment. Thank you. I wish you all health with no discrimination regarding sex, age, race, or socioeconomic status.
Well, thank you very much. One of the take-home points is that with children, it's hard to tell whether or not they have symptoms. Unless you specifically ask them, they're unlikely to complain that they're a little short of breath going up the stairs, or that they maybe have a small headache or have brain fog. Most of the children don't even know what brain fog is, so that it's hard to diagnose a child. You have to really seek out the diagnosis and ask them how things are going, what is happening, how are you able to function at school or in your extracurricular activities. And the long COVID in kids has really been ignored, as also has the dangers of COVID-19. The narrative that children don't spread the infection and that children are possibly, almost immune to COVID-19, or they can't be hospitalized. This is still within our society. I'm very frustrated right now, the lack of attention that we're paying not only to the children, but as a sequela to that, school safety and making our schools as safe as they possibly can with upgrades to ventilation and good protocols on how to deal with children with long COVID or that call in sick. Pandemic is not over, and these are really important issues that we're still wrestling with here in the United States.